Good evening and welcome to this week's edition of Roundtable Talk. This evening, our talk is all about HIV and AIDS. Of course, World AIDS Day was observed on Thursday, December 1, 2022, and St. Vincent and the Grenadines joined with the rest of the world in marking the occasion. To talk the talk this evening, we have our resident medical expert and infectious diseases specialist, as usual, Dr. Gerald Thompson. Thank you, Doctor, for joining us again this evening. We also have Winfield Tanis Abbott, and Winfield is here in dual roles this evening. He is the president of CARE SVG, and he's also the HIV and AIDS coordinator for public sector entities in the Ministry of Health and the Environment attached to the National AIDS Secretariat. I'm going to start off first by talking about the fact that there seems to have been a lull, less visibility where the whole question of HIV and AIDS is concerned in St. Vincent and the Grenadines. I know 15 years ago, there was quite a visible presence, a visible response. First, though, I'm going to ask Dr. Thompson to talk to us about the global situation as of today first.
Thank you very much, Teresa. Um, you know, I recall the first World AIDS Day in 1988. I was doing my fellowship in infectious diseases at University of Medicine in New Jersey, and Prudential Insurance brought together all the religious entities in New Jersey, New York, Connecticut, the tri-state area, and asked if a major effort could be made at public education. And I sad to say, it was a bit disappointment. The church, unfortunately, had said, look, if we have to tell persons to wear condom, if we have to tell persons to have safe sex, this would be tantamount to fornication and adultery, and we cannot do that. I think that that was a rare lost opportunity, and within a matter of years, we saw an explosion of HIV. And then major things happened for 10 to 15 years. But what then took place, AIDS was seen as taking away the joy out of sex, the joy out of life. In the same way, the pandemic that we just had may have taken a lot of joy out of life and people had to stay at home. The bottom line is that people stopped talking about it. A lot of funding moved to other issues, other things in the world. And fortunately, the HIV pandemic became the forgotten pandemic. And I would say that over the last 3 years of the COVID pandemic, some very interesting things has happened. What took place in the last 15 years was in Europe, in North America, because of the availability of medications, drugs, cocktails, and so forth, the incidence of HIV started to drop. The death rate, all those sort of things fell significantly.
Yes.
Yes. But in Africa, especially the southern part of Africa, Botswana, Namibia, and South Africa, and all those places, Soweto, you started seeing rise where almost 1 in 5 adults were infected with HIV in some places. And it was seen that HIV was an African thing now. And the top 15 to 20 countries in the world lied in Africa where the highest incidence was. Unfortunately, over the last 2 years during the pandemic, we've now seen a spike in new cases in Europe.
Yes.
We've seen increased cases in a number of other places coming out of the pandemic. and the whole drop-off of efforts and so has had its impact. And this World AIDS Day is bringing together that there needs to be a unity. All the forces need to come together in order to fight HIV again, in spite of there being a COVID pandemic, in spite of there being the flu, in spite of there being other illnesses around the world and other economic challenges, that we need to draw some attention to HIV. So that's really the global situation. I must say that there's been over 100 million cases of HIV. We passed the 100 million case mark at in January of this year, and there's been over 40 million deaths from HIV. Good news is that with medications, we have seen the death rate drop significantly, and that HIV can become what we consider as a chronic disease, and I'm sure we'll get into it. We now have cocktails and medications that could suppress the virus so that when we actually test to see the viral load, how much viral particles in your blood, it's undetectable. The virus is still there.
Yes.
But it's undetectable, and that has some significant consequences in itself. So let me stop there. And so.
Okay, we'll get back to some of the clinical things, because we need to remind people what this disease really is and how you contract it and so forth. But Winfield, can you give us now the national perspective?
Okay, thank you very much, Teresa. What we have been doing as of recent, and where you said that it looks as if HIV is pushing to the back burner. And one of the reasons for that, it was because in those days, you had the Global Fund money and the World Bank money. And when all of that dried out, everything just fall apart. And we all know in these small islands, where there is money, there's always a hype and a vibe for any pandemic that is happening. On the national side, what we have been doing from the Ministry of Health, we have been training our nurses. We have been now looking at how can we integrate HIV into primary health care. Do we have persons only coming to the National AIDS Secretariat or going to the St. Vincent Planned Parenthood or the Infectious Disease Clinic to have an HIV test done, where they will have to leave all the way coming from Sandy Bay, Fancy, Chateaubelair, Richmond. So what we have been doing as of recent is training all the nurses within the different district clinics so that you can then now go, when you go to see a doctor, or you, let us say you live in Greg's, you want to go to the Greg's clinic and you can have a HIV test done there instead of coming all the way to Kingston to have it done. So that's one of the things we have been doing, and it has been working well. So we have done all this training in the Grenadine Islands and in the different districts, the health districts in St. Vincent and the Grenadines with the different nurses.
Can you tell us anything about numbers locally? Have there been an increase, decrease? What has been happening in regards to those numbers locally?
We have over 850 persons positive presently. And our numbers have not been increasing significantly, and that much I can say. We have not had a big increase at all. What is really happening is that we need to get more into the different communities and the schools, because we know of the promiscuity that goes on among young people between the ages of 16 and 35. So you're finding now that these are the cases that we are getting between 16, 14, more or less 14, 16 to 35.
Wow, that's interesting. Okay, we'll take our first break and come back. When we come back, we're going to talk about what is HIV and those sort of clinical things. Back in just a moment.
I am Dr. Gerald Thompson, an infectious disease specialist. I'm inviting you every week to join our program. Healthy Choices, Healthy Actions, a health program that you need to see.
Thinking of winning the lotto jackpot? Well, there is an easy way. Combo Play. Choose 4 numbers from 1 to 36. That's a combo 4 at a cost of $64. Match any 4 of the 5 numbers and win the lotto jackpot. There's Combo 6, where you purchase 6 numbers for only $12. Match any 5 of the 6 lotto numbers and hit the jackpot. How about Combo 7? That's a purchase of 7 lotto numbers for $42. Match any 5 of the 7 numbers and you will win the jackpot. There are also Combo 3, Combo 8, and Combo 9 lotto plays. Visit the NLA headquarters in Pauls Avenue or WhatsApp 495-6886 for more details. Lotto, you have to be in it to win it.
Read, learn, grow. The children are the future. Help them read, learn, grow. Early reading is the key, so help them read, learn, grow. Let's show them how much fun it is to read, learn, grow. So parents, you play a part. First and foremost, reading from so young is advantageous. Link with the teachers. Working hand in hand is a must. Just 10 minutes of your child reading to you is a plus. Get fun books, make reading priority. When children read, they are able to learn, and the more they learn, the more they grow. So parents help the kids read, learn, grow. Reading is fun, kids have to know. Read, learn, grow. The children are the future. Help them read, learn, grow. So parents, you play a part.
This message is brought to you by the OECS USAID Early Learners Program, funded by United States Agency for International Development. For more information, log on to www.oecs.org/ELP.
Welcome back. Doc, let's start at the basics. What is HIV?
Well, let's focus on the virus itself. It's, there are literally tens of thousands of different viruses, and this particular virus is a retrovirus, and there's an unusual feature about it. Whereas the flu virus wants to give you a cold and a sneeze and so forth, or measles virus could give you a rash and things like that. The retrovirus, the HIV virus, basically, once it gets into your system, which can be by different means, often sexual contact, blood transfusion, if you have used a needle repeatedly and shared it and so forth. And these were the old methods. When it first started, we say the 4 H's. If you were hemophiliac and you receive a blood transfusion, if you were a heroin abuser and shared your needles, if you were a homosexual, or if you were a Haitian. Those were the early days. It has spread far more into the heterosexual population, and it is considered to be a sexually transmitted disease. When the virus gets into your system, the virus is so smart, it doesn't attack so much anything. It wants to get at your immune system. And there are a number of white blood cells that make up your immune system. One of them is the general of the immune system, called your T cells or your T helper cells. We call them CD4 cells. And the virus attacks those cells. And because you're attacking the general, it's able to multiply inside of that T cell, jump out, infect other T cells, and sometimes a lot of other tissues, and the immune system is unable to respond because you have attacked the generals. Now, what then happens over a period of time is when the virus gets in, there's an acute infection, which lasts just for a matter of couple of weeks. And then the virus, as it starts to attack more cells in your immune system, then you are more or less HIV positive. We saw that's a particular phase. We got the second phase. Then it can become chronic. And once the number of those T cells drop because they're being destroyed, as the virus multiplies inside them,
yes,
they use the T cells to multiply and jump out and infect other cells, but at the same time it kills the T cells. And so the number of T cells start to drop. And when it starts to drop below a figure, let's say 200, right, or so, you then have a situation where you are defined as having AIDS. The other definitions of AIDS is when in what we call the late stage of AIDS,
yes,
where things have dropped so much that you start losing weight, that there are the lack of your proper immune system, opportunistic infections that you normally would have. There's a fungus that's sometimes in your lungs you're exposed to, pneumocystis carinii. Everyone has it, and we live with it. But because your immune system has been suppressed and damaged to some degree, when the cat's away,
yes,
the mice will play.
Yes.
And the pneumocystis carinii starts to jump out. If you have had TB in the past, the TB can become reactivated. If you have certain germs in your intestine, they could become just hyper-aggressive. When the cat's away, the mice will play. Cancer, your immune system controls cancer. And there's strange type of cancers develop. Opportunistic infections
yes,
start developing, all type. We could go down and talk about them. Now, I want to tell you that there, and let me, before Taz comes in, there's a misunderstanding. They're thinking that there's only one HIV. There's two types of HIV, HIV-1
yes, and HIV.
and HIV-2.
Yes.
And just like COVID, all these two HIVs, there have been mutations and different strains. There are over now almost 15 to 20 different strains. And depending if you're in America, there's a particular strain that's common.
Yes.
In West Africa, there's a different type of HIV-2 is more common in West Africa. In other parts of the world, maybe HIV-1, but it's a different group and a different variety, a different, strain that is there. And we have been seeing new strains emerging, just like how COVID went through Gamma and Delta and Omicron. The HIV virus has gone through that too. And sadly, they could become more resistant to the medications. And I let Winfield probably talk a little bit. Great news is that they're now, over the last 41 years of HIV, we've been able to develop a lot of good medications that
yes,
can now suppress the virus. But you got to make sure that those medications could deal with that strain
yes,
of the virus.
Yes.
If not, there'll be resistance. And when you think you're being treated, the HIV AIDS is marching on inside of you. We're not hearing you, Teresa.
We're not hearing you.
Okay, all right. Now you're hearing me, right?
You bet.
So I was saying before Winfield comes on, at what stage or what point does HIV become full-blown AIDS?
Can I just do something before you respond? Where Dr. Thompson spoke about the different strain, and another thing that most people don't know, you can be reinfected. So you can be infected with HIV, and if both persons not using condom because of the different strain in each of them, they can also become reinfected, and I think it can happen more than once as well.
And this is what's called a super infection,
Yes.
where some people could be infected with two different strains of the virus at the same time.
Yes.
You know, and I tell you, I was on the case, this is way back, 1989, of the first case of HIV-2 in the United States. Things have gone a long way since that time, you know. In terms of your question related to at what stage, you were asking what stage persons become
full-blown AIDS.
Let me say that some strains progress a lot quicker towards full-blown AIDS than others. The HIV-2 is a much slower progressive virus and takes a longer time and is not as severe as the HIV in most cases. However, depending on the type of individual and depending on other factors, underlying condition, things could change, very differently. But on average, it can take a number of years. Somebody can have a chronic infection with HIV and may not know it. But putting all that aside, we've now realized that if you are treated early, if you start treatment early, the rate of progression towards AIDS is significantly slowed. And if you have AIDS, you could actually halt the progression of the AIDS itself. So your question asks is, how long does it take? But it isn't that, well, you're HIV positive and therefore you could sit down and wait until a year or 2 years before you start medication because you're not full-blown AIDS yet. To prevent you progressing towards full-blown AIDS, the thinking today and the strategy today is to start treatment early to prevent, whether you've had chronic HIV, you've been just diagnosed and so forth, and you're still okay, no problems. Can you sit back and wait for 2 years? Can you sit back and wait for 3 years?
No.
Is it 4 years, 5 years, 6 years? No, it is now. Start now with medication, and that is the best way of stopping the progression towards full-blown AIDS.
Okay, so we'll take our second break, and when we come back, I want to talk about how does HIV spread and what are some of the symptoms. Back in a short moment.
I am Dr. Gerald Thompson, an infectious disease specialist. I'm inviting you every week to join our program, Healthy Choices, Healthy Actions, a health program that you need to see.
Thinking of winning the lotto jackpot? Well, there is an easy way. Combo Play. Choose 4 numbers from 1 to 36. That's a combo 4 at a cost of $64. Match any 4 of the 5 numbers and win the lotto jackpot. There's Combo 6, where you purchase 6 numbers for only $12. Match any 5 of the 6 lotto numbers and hit the jackpot. How about Combo 7? That's a purchase of 7 lotto numbers for $42. Match any 5 of the 7 numbers and you will win the jackpot. There are also Combo 3, Combo 8, and Combo 9 lotto plays. Visit the NLA headquarters in Pauls Avenue or WhatsApp 495-6886 for more details. Lotto, you have to be in it to win it.
Welcome back. Doc, what are some of the symptoms or what are the symptoms of HIV and how does it spread?
Somebody who gets an acute infection, just like any virus, they have a little fever, they will have a headache, just like any kind of like a flu symptom. Now, you can't tell that it is HIV.
Yes.
Now, however, an infection could have occurred. And therefore, the virus sets up this chronic infection that will eventually, over a period of time, leads to AIDS. And during that time that the person has a chronic infection, they may not have any symptoms, you know? They may actually feel quite okay. What we have been looking at is not waiting until somebody develops the symptoms relating to full-blown AIDS, in which they could start losing weight, they could start having diarrhea, they could start having different types of rashes or changes in their skin. They could start developing something called thrush in the back of their throat, where there's a little fungal infection. There's a host of things. But again, Teresa, I'm trying to emphasize, this is just like checking for prostate, this is just like regular annual breast exams for a lady. People, I think, irrespective of whether they're in a normal relationship or not, they should be open to getting tested and being assured that their test is a confidential one, and they could have a relationship with their physician or with their clinic, and picking up any sort of illness early. Now, I framed it in that way because people generally just keep their fingers crossed and will not get tested until they develop some sort of symptom. And I could rattle off other set of symptoms that may affect certain people. But I think the emphasis now is on people detecting that they may be HIV positive early, double checking it by repeating the test. You may repeat the test several times to make absolutely sure that it isn't a false positive and all this kind of thing. But we now have PCR, we now have sophisticated tests, so those chances are really limited. But repeating it is important. And then getting early treatment. And I've said that before, but that is the symptoms and all those other things of the advanced AIDS is one thing. Mm-hmm. And they could go in many, many different directions. I don't want to go down that road. I want to start that picking it up very early and seeing how we could stop those symptoms ever developing at any point in time.
Okay, Winfield, what are the two organizations for which you work doing to ensure or to encourage people to do more testing? Bear in mind also that you mentioned that people as young as 14 are contracting HIV in our community.
And I should say those that would have been from vertical transmission, where it would have been from mother to child. But we have what we call care SVG, and I just want to add on to what Dr. Thompson said. Once you come to our facility, and we do what we call rapid tests. So once you come to our facility and it shows that we do not say positive. We say, how do you say it again?
There's a presumptive thing.
Yes, and we take, sorry about that, and we say reactive. And then we will take you or send you to have a conformity test, which is done at the lab. And once that test will show that it is positive, and then when that is positive, you go into the infectious disease clinic where the doctor will see you. Then she will send you to do all different type of test, and from there on, you're treated. So you are positive, you're tested positive, then you're treated. So we do what we call test and treat. So it's not where you take a long time, 2-3 months after. We stop any progression of any other viruses attacking the body. We have what we call CARE SVG, and it is CARE Advocacy Reaching Out, Empowering St. Vincent and the Grenadines, of which I'm the president. It is an organization for people living with and affected by HIV/AIDS. It is a support group. So we are here to make sure that persons who are positive go into treatment, and those persons who are not positive to continue living the life that they're living, having one sexual partner, using condom. And for those who are not sure if they should come to do a test, we do encourage them. So we normally do what we call this body to body. So let us say it is someone from the LGBTQI community who comes to do a test. What we will say to that one person, why don't you go and have a conversation with your other friends? Ask them, encourage them to come do a test. Let them come, talk to us, and from there on, we see them start bringing their friends, coming to do more and more tests. We have been seeing more men come in sometimes at the end of the month. If we do 100 tests, it will be like 40, 50 men. And we have been seeing children bringing their parents with them and letting their parents know, even though they're having sex, they're doing it the safe way, and they want them to see they're not HIV positive or they're syphilis positive.
Let's talk about some of the services that both entities with which you are connected offer.
Okay, what we do offer is rapid HIV and syphilis testing, and we also do counseling and referrals, because we do not have a doctor at the National AIDS Secretariat. So once you're positive, once we see that reactive result, it goes to the lab, and then we send you straight to the infectious disease clinic. And the infectious disease clinic deals with it from there. Then they tell us in CARE SVG so that we can get them food packages and sort of encourage them. Yes, you are positive, but it's not the end of the world. And we're here as your friends to help channel you through that process, because normally the first 6 months of a positive result is the hardest 6 months anyone can face.
Let's talk about transmission. I think it's important for us to talk about transmission and how is HIV transmitted.
Yes, let me first of all say that I remember CP's song in the 90s. And I remember speaking to him and saying, you know what? AIDS soon is no longer going to be a death sentence.
And it is not now.
And today, it's no longer. The mortality rate in 1990 was in the 70 percentile. By 2010, it had dropped. Today, the mortality rate is less than 3 or 4%.
Yes, by far, yeah.
You know? That means that it's now a chronic disease,
yes,
and people could live very long time. You would ask the question earlier on about how long does it take for somebody to become AIDS. Really, truly, I didn't want to say it, but it's maybe about 8 to 10 years. So therefore, and during that time, a person may not have any symptoms at all.
Exactly.
So a person who doesn't know that they have HIV, never been tested, don't have any symptoms, may continue with whatever lifestyle or activities they're having. They may choose to give blood. Luckily today, any blood that's given is tested for HIV so as not to contaminate the blood supply, and they're fairly good at that. So blood transfusion being a means of transmission is limited. In St. Vincent, we don't have a culture of IV drug abusers.
No.
And we are not like what happened in the 80s and 90s in certain parts of the world, where when they were given injections, like a vaccine, they would jab one person, take it out, and jab somebody, you shake it off in some alcohol and jab another person. You know, we changed the needle.
Yeah.
So those methods of IV drug abuse and so forth and things like that are quite limited. What we have got is really heterosexual homosexuality, and what it could take is taking place from oral sex. It takes place also through breastfeeding. There's maternal to fetal transmission. So a woman who is pregnant can basically transmit it. And what we say is that, once again, you've heard me with this theme, treatment, early treatment.
Yes.
Now, it is said, and I'm sure you've seen on television, that certain medication, if the person receives the cocktail of medication, then the treatment, if you just give one drug, that ain't good enough. Resistance will develop quickly. It sometimes takes tackling the virus from the north, from this way, trying to get the virus from this way, and getting the virus from that other direction. And those different types of medication together in a cocktail, whether 2 drugs or 3 drugs often, is usually enough to suppress that virus and also prevent the risk of resistance developing to any of those drugs. You know, if you use one drug, bet you in a matter of months and so resistance will develop and the drug is going to be of any use. So that suppresses the virus. And it is said that persons may not be as contagious as if they didn't know or if they were having, didn't have any medication at all. So it's a complex issue. Here in St. Vincent, I don't think we push that if you're on the virus, you are able to have sex without a condom. You know what I mean? Some places actually say that. I think that that is really not the way necessarily to go.
We don't do that here in St. Vincent because, well, we know that undetectable equal untransmissible, you can have unprotected sex without a condom. It has been clinically proven, but I will not say that to any client who come to me because I always still believe in using a condom, regardless because anything can happen. And in terms of medication, Dr. Thompson, in St. Vincent, most persons will get, you take 1 in the morning, 1 in the afternoon, and the medication changes often, and most times, and you know the medication goes line 1, line 2, line 3, and most times there's some people who may not feel good after taking the medication, let's say about a month or 2. But what we usually advise them is that maybe you need to change your diet. You need to see what you are eating. And I always say to them, ask the doctor, question the doctor, why are you having stomach ache? Why are you vomiting, having diarrhea? And instead of keep taking the medication, you're getting worse, you're not feeling any better, and then the doctor can advise you what needs to be done in order for you to be able to take the medication.
How readily available is treatment or medication for those who are affected here in St. Vincent and the Grenadines?
Throughout the whole Caribbean, and I can say with pride that I was part of that process because I used to be on the PANCAP CARICOM UN board, and that was something that we always wanted, that medication for people living with HIV, because it can be very costly, and Dr. Thompson will know that, should be free. And not only medication should be free for them, healthcare services coming from the government institution should and must be free. And that has been for the past couple of years now.
Okay, we'll take our final break. When we come back, we'll talk about things we need to do to prevent transmission. We'll also talk about what are some of the things we need to put in place to ensure that the national effort is sustained. Back in a moment.
I am Dr. Gerald Thompson, an infectious disease specialist. I'm inviting you every week to join our program, Healthy choices, healthy actions. A health program that you need to see.
Thinking of winning the lotto jackpot? Well, there is an easy way. Combo Play. Choose 4 numbers from 1 to 36. That's a combo 4 at a cost of $64. Match any 4 of the 5 numbers and win the lotto jackpot. There's Combo 6, where you purchase 6 numbers for only $12. Match any 5 of the 6 lotto numbers and hit the jackpot. How about Combo 7? That's a purchase of 7 lotto numbers for $42. Match any 5 of the 7 numbers and you will win the jackpot. There are also Combo 3, Combo 8, and Combo 9 lotto plays. Visit the NLA headquarters in Pauls Avenue or WhatsApp 495-6886 for more details. Lotto, you have to be in it to win it.
Welcome back. Stigma and discrimination have always been proffered as two of the things that have been barriers to treatment and prevention of HIV and AIDS. How much of that still holds true in your own experience working on the ground, and also your response, doctor, as well to this? But a response from both of you on this important issue would be.
Let me answer that one. We have sort of diffused that stigma and discrimination to an extent where what we are seeing a lot now is self-stigma and self-discrimination coming from the persons themselves living with HIV. And gone are the days when people were afraid to come to the National AIDS Secretariat to have a test done. As I told you before, we are seeing young people in their numbers. We are seeing key population in their numbers coming. And we are seeing them bringing their partners as well. We are seeing parents bringing their children. And that shows that because of the confidentiality and because HIV has now become a chronic disease, that they rather know than not knowing. And one of the things we always encourage is that for you to know your status, you must be tested. That's the only how you can know your status. There's no other way out. And that's one of the things we keep preaching. Once you don't put fear into people, you just tell them it's a simple process. This is what will be done. We will take you through the process. We will counsel you. And if you're positive, it is your choice to tell your parents. If you choose not to, if you need us to be there with you, to tell your parents, we will be there. But everything has to be you. And that's the thing that we have to learn as individuals. Our health is a shared responsibility, and also our health is our own responsibility. And if we know that we are living promiscuous life, if we know that we have 10 sexual partners and we're using condom on 2 and no condom on 8, we are then put in that bracket of high risk. What do we do when we're in the high risk bracket? We sit down, we talk to ourselves, we say, boy, I can't go on with this. Who do I call? Where do I seek the help? Will I be stigmatized or discriminated? And then you have to weigh, do you rather be stigmatized and discriminated? And you ask yourself, or do I want to become HIV positive with other STI and STDs? Which do I need? And I always say, the one to have an HIV test done always wins the battle.
So what can be done with regards to what you have described as the self-stigma? What do you think can be done?
What needs to be done, and I always say to the members of CARE SVG, you have to know who you are, 1. You have to understand your purpose, 2. yes, you're HIV positive. Yes, it's something that will kill me, but also it is something where I can live a long life with. How do I do that? We need to, so we are forming what we call a body-to-body thing where I will call you, you will call Dr. Thompson, and find out how are you doing, what are you doing, how are you feeling, did you take your medication? Because sometimes those same people don't realize that they're telling their friends what is happening to them, the way they behave in front of your friends, and your friends start becoming suspicious. When your friends start talking about it, you're like, but I didn't tell you. But it's not that you didn't tell the person, the way your body language, the way you reacted. So I'm teaching them that go out into the world with confidence. HIV is not going to kill you. You look good, dress up, do something for yourself, be you, and everything else will fall in place.
Doc, in terms of new treatments, are any on the horizon that you know of?
I tell you, over the last 41 years, we've always held out hope in relation to a vaccine. Recently, there's been some major advances in terms of what we call a phase 1 trial. It may pan out, it may not. But developing a vaccine for HIV is difficult because the virus is mutating so rapidly.
Yes.
When you've developed a vaccine, the virus has already moved to some other stage, some other thing, and resistant to that particular thing. But what I want to say is that we've mastered now, there's lots of medications, the types of medication available, so that if you're having difficulties with one could go to the other. Yes, that medication may not necessarily be available in savings, but it can be obtained. We're even to the stage where you could really get an injection of medication that could last you a whole month instead of taking tablets and so forth.
Yes.
But I want to say it's also about nutrition.
Yes.
It's about nutrition and losing weight. Now, I got to say this. I am still a little haunted by the hundreds of patients that I've lost. People of all professions, and so since the 80s. Sometimes I'll see somebody and I say, boy, that reminds me of a patient I lost. Because in those days, we did not necessarily have the best treatment, or we didn't understand nutrition, we didn't understand the social, the people who committed suicide, the people who did all kind of funny things. Because, as Winfield said, it's a chronic disease and it's not a death sentence, it has changed the concept.
Yes.
That person now has said, well, boy, let me go on a holiday and spend off my money and so forth because in a few months I might die. No.
That's not the case.
It is that you could live a normal life, conduct a normal profession. You could be a fireman, a policeman, a teacher. You could be anything you want to be, even though you have HIV. Just as if you had hepatitis or if you had some other illness. The thing is that we just want you to be conscious of the people you have relationship with.
Yes.
Your wife.
Yes.
Your partner, whoever you're with. You have to have that relationship where they understand. Sadly, I think some people may still be a little scared, and they do conduct activities with persons having not told them what that person should have a choice. But some people are still afraid, even though the stigma has gone, some people are afraid of what somebody will say.
Yes.
And that person's lack of understanding that, the disease may be chronic. Or the fact you may want to wear a condom and the person you will have a sexual relationship tells you, well, why you want to wear a condom? It feels better without, And you then are wondering what to do. Do you take a chance and so forth? I think a lot of people. I think gone are the days to when people may willfully do it, even though that may still exist.
That is true. Yeah.
And I think though, I'm the CEO of the medicinal cannabis store. I'm really glad we've also included as one of the 20 conditions the use of medicinal cannabis for HIV patients if they want one method of maintaining their appetite if they're losing weight and so forth.
Okay, very good.
I know various doctors and so have utilized it and so forth, and it's a very, but the cannabis is not going to cure AIDS. You understand?
Yeah.
I don't want to give that particular impression, but it's one of the list of things that is being, you ask for new things, that's something that's old, being used in a new format. But there are now a lot of medications that a person can live with HIV and can live a normal life and can do other things whilst they are conscious that they should keep within the bounds of not spreading the disease or the virus to anybody else.
Yes.
Okay, and finally, before we go, the theme of World AIDS Day 2022 was equalize. Do you both see a time when we would equalize as far as HIV and AIDS is concerned?
It is happening right now, and that was why I said we are seeing, especially from the key population, they are now more moving towards being tested. And we are now seeing that people where it was only one class of people who, we're now seeing everybody getting that opportunity. And once the LGBTQI community start coming out in their numbers, because it was thought that they were the one who were the major spreaders of HIV, but that's not a fact. It is actually the heterosexuals, because the heterosexuals themselves are having sex with men, having sex with women, but still say that they are heterosexual. So the LGBTQI community is now leading the way because they're seeing spaces are being opened for them. The clinics are being more accommodative for them. And once that is happening, I can see equalize happening, but I am still way far looking to see AIDS ending by 2030, which seem a bit impossible.
Yes, let me say that I am still a little concerned that when it comes around to World AIDS Day, this is the time we talk about these particular things to a great extent. I think, as we've seen with COVID, there are going to be challenges getting to people, attitudes, conspiracy theories, all these sort of things will come out. But it's really my hope that HIV becomes a major, continues to be a priority, and that we do not fall into the situation like some Southern African nations where 1 in 5, one of the free states, Botswana, Soweto, Namibia, South Africa itself, they have infection rates of almost 10-20%. One country in particular, right, called Eswatini, Eswatini, they have almost 28% of their adult population. Now, St. Vincent is considered, I gotta say this, one of the second highest in the Caribbean. But we are considered that way because our population is small, and of 100,000, having 800 to maybe 1,000 persons, you're then considered as 1%. Haiti is considered to be the highest in the Caribbean. But other islands are not too far behind in that list. What it tells us is that we really do have to take care in promoting what's considered to be safe sex, and also the responsibility of the individual who may be HIV.
Exactly.
And also the purpose and the responsibility of each person to go out and be tested, so that you will know, because we could treat you very early and prevent you from going down that slippery slope of your immune system becoming deficient, opportunistic infection developing, and along the way, you infecting somebody else because you didn't know or you didn't care. I think that this is very important, and I'm making an appeal to everyone in St. Vincent and the Grenadines. Get tested, you know? Get tested.
Know your status.
Know your status. Know your status. And that's going to help, you know. In the same way, we want you to check your sugar, check your pressure, check your, if you're a male, check your prostate PSA. For female, you know, get a mammogram, so depending on what age you are and so forth. Get a HIV test as well. And I'm sure that the confidential nature of how these things are done today, you know, you could be assured that this is something that you put your mind at rest.
Yes.
And either you don't have it, or that if you do have it, you could start treatment very early.
And Teresa, we will be in Sandy Bay. On Saturday, we will be in Sandy Bay from 9 to 3. We will be doing rapid HIV syphilis tests at the Sandy Bay Health Clinic. So we will be out there for most of the day, ensuring that those people from Georgetown come back, go up, will be able to have a chance of knowing their status by getting tested.
Okay, thank you very much, Winfield. Thank you very much, Doc. A perfect note on which to end this evening's edition of Roundtable Talk. That's our program for today. So glad that you could join us. Doc, I always have to say thank you to you a million times. I feel as though I've been really overworking you, but it is what it is. Ever the dependable. So thank you continuously. And also, thank you very much, Mr. Tanis Abbott, for sharing with us this evening.
Thank you very much.
Good evening. Until next week, Wednesday, from all of us here at RTT. Also want to say congratulations to a member of our team, Zoro Bennett, who became a dad today. Congratulations. See you again next week, Wednesday, same time, 6 in the evening. Good evening.